Hello there, I'm Dr. Safwan Ahmad Khan, consultant pediatric surgeon using the AI voice. I know that hearing your child has appendicitis can be scary, but please know that this is a very common condition, and the treatment is highly successful. This guide will help you understand what's happening and what to expect. What is appendicitis? The appendix is a small, finger-shaped tube attached to the large intestine. Think of it as a small, closed-ended pocket. Appendicitis is what happens when this little tube becomes blocked and then infected. The blockage can be from hard stool, mucus, or swollen tissue. Once blocked, bacteria can grow inside it, causing it to become swollen, filled with pus, and painful. If not treated, it can burst. How common is this condition? Appendicitis is quite common in children and teenagers. It is the most common reason for emergency abdominal surgery in childhood. While it can happen at any age, it occurs most often in people between the ages of 10 and 30. What are the signs and symptoms? The symptoms can vary, especially in younger children, but the most common signs include belly pain. This usually starts around the belly button and then moves to the lower right part of the belly. The pain typically gets worse over time and is often more painful with movement or coughing. Fever. A low-grade fever is common. Loss of appetite. Your child may not want to eat. Nausea and vomiting. This often comes after the pain has started. Your child may seem unusually quiet, irritable, or want to lie very still. How is this condition diagnosed? There is no single test for appendicitis. Doctors will use a combination of methods to make the diagnosis. Physical exam. The doctor will gently press on your child's belly to feel for the location of the pain and signs of tightness. Blood test. This checks for a high white blood cell count, which is a sign of infection in the body. Urine test. This is done to rule out a urinary tract infection, which can have similar symptoms. Ultrasound. This is a painless test that uses sound waves to create a picture of the inside of the belly. It allows the doctor to see if the appendix looks swollen. How is appendicitis treated? Surgical treatment. The goal of the surgery, called an appendectomy, is to safely remove the infected appendix. This is almost always done using a minimally invasive technique called laparoscopy. The surgeon makes a few very small cuts in the belly. A tiny camera is inserted through one cut, allowing the surgeon to see inside on a screen. Special small instruments are used through the other cuts to gently detach and remove the appendix. What are the risks and complications? From the condition itself, the biggest risk if appendicitis is not treated is that the appendix can burst or rupture. This spreads the infection throughout the belly, a serious condition called peritonitis, which requires a longer hospital stay and more complex recovery. From the surgery is very safe, but all surgeries have some risk. These include reactions to anesthesia, bleeding, or infection at the incision sites. After surgery, there is a small chance of developing an infection inside the belly, an abscess, which might require additional drainage. These complications are uncommon. After the procedure, care and recovery. In the hospital, right after surgery, your child will be watched closely as they wake up from anesthesia. They will have an IV line for fluids and pain medication. We will help manage any pain to keep them comfortable. Most children can start drinking clear fluids a few hours after surgery, and can often go home within 24 to 48 hours if they are doing well. At home. Your main job at home is to help your child rest and heal. Pain management. Give pain medication exactly as directed by your doctor. Wound care. Keep the small incision sites clean and dry. Your child may be able to shower after a day or two, but avoid baths or swimming until your doctor says it's okay. Diet. Start with bland, easy-to-digest foods like soup, toast, and bananas. Your child can return to a normal diet as their appetite returns. Activity. No rough play, sports, or heavy lifting, like a heavy backpack, for about 2 weeks, or as long as your doctor recommends. Walking around the house is encouraged. Call the doctor if you notice fever over 101 degrees Fahrenheit, 38.3 degrees Celsius, redness, swelling or pus from the incisions, vomiting, or if the belly pain gets worse. What is the long-term outlook? The long-term outlook for a child after an appendectomy is excellent. Removing the appendix causes no long-term health problems. The body functions perfectly normally without it. Once your child has recovered from surgery, they can return to all their normal activities and live a full, healthy life. This is a one-time problem with a definitive cure.